Looks like it's done.
Don't let salmonella get funky with your chicken. On average, 1 in 6 Americans will get a foodborne illness this year. You can't see these microbes, but they might be there. So learn the right temperature to cook each type of meat. Keep your family safe at foodsafety.gov.
Thank you very much. This is a wonderful day in Cleveland. I'm Louis Stokes, and it's my pleasure and my honor at this time to welcome everyone to the campus of Cleveland State University and the new Center for Innovation in Medical Professions, and I thank all of you for joining us here today. I serve with Dr. Edgar Jackson as co-chair of the Community Advisory Board for the Partnership for Urban Health, which is an initiative that brought together Cleveland State University and Northeast Ohio Medical University to address two important needs that we face in our region's healthcare system. The first need I refer to is access to quality primary care for everyone, especially in our urban neighborhoods. Our urban areas face a unique set of health challenges that, if left unaddressed, negatively impact quality of life. We are creating healthcare deserts in the very community that need help the most. The individuals who provide health care to a neighborhood, especially primary care providers, serve as guides to residents on how to lead healthy lives, prevent illness, and care for those in need. The second need relates to building opportunities to join and lead our healthcare workforce. Physicians play critical roles in our lives from start to finish, and it continues to be one of the noblest professions in our society. However, we must make great strides in improving diversity in the profession, including creating pathways to careers as physicians for students from underserved urban areas. Two very important institutions, Cleveland State University and NeoMed, understand these needs, and several years came together to develop the Partnership for Urban Health. With grant-making support from the Cleveland Foundation, another very important institution in our community, they recognize as educators and community leaders, they have the ability to help us shape the healthcare workforce to address these important issues and care for our community. With that, I'd like to introduce to you now to the president and the CEO of the Cleveland Foundation, my dear friend, Ron Richard, who's going to share a very special announcement with us today. And at this time, it's an honor and a pleasure to welcome to the podium Mr. Ron Richard. Thank you, Jim. Thank you.
Wow, what a building. That wasn't in the script. Good afternoon, everybody. On behalf of my board, what a pleasure it is to join everyone inside this wonderful new Center for Innovation in Medical Professions, and thank you so much for joining us today on pretty short notice. This building could not have a more fitting name. It is here that two of our region's best academic institutions are collaborating on an innovative and urgent solution to one of our community's most pressing problems. For more than a century, the Cleveland Foundation's mission has been to enhance the lives of all Greater Clevelanders, now and for generations to come. And for more than 100 years, and with more than $1.8 billion in civic investments, we've partnered with our donors to better the Greater Cleveland community. But unless all of our citizens are healthy and thriving, we cannot enjoy Cleveland's nascent renaissance. And too many of our citizens are suffering from preventable and treatable illnesses, from obesity and attendant scourges like diabetes, heart disease, and cancer, lung disease tied to smoking and poor air quality, and the results of exposure to harmful substances. We also suffer from a really shameful citywide infant mortality rate. In fact, Ohio's African-American infant mortality rate is the worst in the nation, signaling yet again the wide disparities among our community's neighborhoods. And while each of us must take ownership of our own health, we must also have access to physicians and services to help us and show us the path to a healthier future. The shortage of primary care doctors who practice in urban areas in our city's most underserved communities is a huge problem, and it's likely to get worse. It is these neighborhoods, our most vulnerable population, who will be most impacted by the shortage as they suffer and in some cases even die prematurely from treatable chronic diseases. That is why this collaboration of Cleveland State University and the Northeast Ohio Medical University is the prescription for a healthier tomorrow. The Partnership for Urban Health addresses this primary care challenge by recruiting and training medical students who reflect the socioeconomic background and cultural makeup of their communities. These students will immerse themselves in the urban issues shaping society and health throughout their 6 years of science and medical courses. That includes a 4-year pairing with federally qualified health centers and our healthcare system providers based in a medically underserved Cleveland neighborhood. I cannot emphasize enough how critical this neighborhood-based learning is to solving our community's health challenges. Unless you immerse yourself in the community, you cannot treat the community. To that end, we look forward to a cohort of students making home visits in partnership with nurses, pharmacists, social workers, and others as part of their education in an integrated approach to personalized care for our residents. Throughout their training, students and community partners will continue to champion service learning projects to gather reliable data about our community's most pressing needs. This community-based learning and service is exactly what your community foundation, the Cleveland Foundation, supports and celebrates. We also celebrate 2 institutions we greatly admire, Northeast Ohio Medical University and Cleveland State University. We have great confidence in Presidents Ron Berkman and Jay Gershon and the boards of these institutions. As a result, we are very proud to announce a $5.5 million grant to Cleveland State University. Thank you. We're excited too. To Cleveland State University to support the NeoMed CSU Partnership for Urban Health. This grant, the largest in the partnership's history and our largest grant in 2015 to date, is just the latest testament of our faith in this partnership to improve health outcomes in our neighborhoods. With today's announcement and our earlier grants, we've now provided more than $7.2 million to create a new army of NeoMed CSU compassionate caregivers. And of course, we hope and expect that these compassionate caregivers will remain here after they graduate to become a part of the long-term healthcare solution and contribute to our rich urban cultural fabric. We believe this innovative partnership will become a national best practice for urban primary care education because of the strong and visionary leadership in place to make it happen. I'd like to thank Partnership Director, Dr. Sonia Harris Haywood, and the Community Advisory Board co-chaired by our very respected community leaders and my very dear friends, Dr. Edgar Jackson, and of course, the Honorable Louis Stokes. Focusing on our community's health is the greatest return on any investment that we could hope for. We look forward to a healthier tomorrow that begins today, so thank you all very much for coming. All right. And now, Dr. Berkman.
Good afternoon, everybody. Welcome to the beginning. So I want to, since Ron has done a remarkable job in talking about our goals and talking about our aspirations, in describing what we believe is not only a program for Cleveland, but a program for America, a program designed to create a new generation of healthcare providers, a program that trains those providers in the neighborhood where they will provide, that connects them with families, that provides a medical education that is not episodic, that at a trainee physician sees a patient in an emergency room and then they go away, and then they see another patient, but the opportunities for our students to connect with families, uncles, aunts, children's, brothers, cousins, friends, the faith community, etc. So I believe that we are blazing a trail here in creating a new generation of healthcare workers who, as Ron said, must train together. They must go into these neighborhoods together. It's not sufficient for them to train in a silo, then be put into a situation where somehow magically they're expected to work as a team. We want to teach them as a team from the beginning, from the start of their clinical training. And that's the mantra. The remainder of what I want to say are really thank yous. First of all, to the Board of Trustees of CSU. And we have I think we almost have a quorum here. Chairman Rawson, Chairman Adler, Chairman Gunning, Kirk, Vice Chair Moreno, and Chairwoman, Trustee June Taylor. I want to also express, and all of this is about partnership. Fundamentally, when we untangle this is about partnership. So I need to recognize the representatives of the partnerships, the greater partnerships that are in this room. First of all, the chairs of our advisory board, Congressman Lou Stokes and Dr. Edgar Jackson. We could wait to the end of the recognition so someone doesn't feel they got more applause than somebody else. We know that hands get tired as you go further down the list. Our provider partners, represented here today by Dr. Akram Boutros, the CEO of Metro Health, and Dr. Giselle Green from St. Vincent's. Our neighborhood partners, the federally qualified healthcare centers and the ambulatory care facilities in each of these neighborhoods. Our faith-based community brought together by Reverend Bo Rowan early on in this process. So when we convened with Congressman Stokes and Ed Jackson, a convening of the faith-based community throughout Cleveland to bring them into this. Our other foundation partners represented by Mitch Bach from Mount Sinai, our collaborators in the other health science programs, nursing, occupational therapy, physical therapy, speech-language pathology, public health, music therapy, social work. That's right, the entire menu of what we need for a healthy recipe are here in this building together, working together, training together, learning together. And of course, our partners at NeoMed, from the very beginning, believers and collaborators. We need a special shout out to Mayor Frank Jackson, who I brought this partnership to early on, okay? And I told them, you know, Mr. Mayor Jackson, that, you know, there's other universities that are interested in having this, and there are other mayors, okay, who will work hard to have this, okay? And Mayor Jackson said, when I tell you I'm in, I'm in. Mayor, Mayor Jackson.
You know, I want to congratulate Dr. Berkman, Cleveland State, and Dr. Gershon from NeoMed for not only this building, but the program and the gift that they're receiving today. And I want to thank Ron Richard from the Cleveland Foundation for, again, demonstrating, he and the foundation, their commitment to Cleveland and to the people of the city of Cleveland, and particularly those who are least able to provide for themselves. You know, as I've gone through my professional life, I've recognized that there's never a mystery as to how to solve what we believe are pressing problems. And the problem of the healthcare disparity is not a mystery as to how you resolve it. We just fail to have will and ability to, or the will to execute on what we know the solutions are. What this has done with this partnership and with this funding is help us to execute on what we know works, to bring young people into urban centers, to work with urban people who are in need of health care, and to help reduce that disparity and to help them have a better quality of life. So I want to congratulate you and thank you on accomplishing it. But as Dr. Berkman said, when I first became mayor, this was one of the first things that was brought to my attention, and both he and Dr. Gershon called me and asked if I would help in doing it, and I said yes, yes, in the way he said yes. And so I want to introduce to you Dr. Gershon.
Thank you very much, Mayor. One of the advantages of going last toward the end is I get to thank the same people that have been thanked already, and I plan on doing that. So, on behalf of NeoMed, I would like to express our excitement and thanks for this incredible grant. I want to recognize the board members from NeoMed who are here today, Daisy Alfred-Smith, Paul Bishop, I think is in the back over there, Vice Chair David Heller, and I also want to recognize the former chair of the board, Rick Kodish. Thank you for being here and supporting not only this event, but all the activities that we have taken to lead us to this point. None of this is possible without the dedicated, talented people, organizations, and supporters of our community who care enough to make this kind of thing happen. Thank you, Cleveland Foundation, Ron Richard and your associates, for your strong support of this important program from day one. They were here at the beginning and helped us bridge the funding until the state funding came in. Thank you, President Ron Berkman, for being a great partner and a friend, and to facilitate our two universities coming together to really create something special. Special thanks to Dr. Edgar Jackson, Honorable Louis Stokes, you've heard, for their leadership and incredible work with the 14-member Community Advisory Board. And thank you again, Mayor Jackson. Governor Kasich had a role in this. State legislators, university boards, foundation boards, and leadership teams of both universities, as well as all our clinical partners in Cleveland. Particular thanks goes to Dean of Medicine and Vice President for Health Affairs, Jeff Sussman, for all his hard work on the medical side. The commitment and dedication of all of you has made the success of this urban health initiative possible. I also want to recognize the support of Dr. Louis Sullivan, who is the former HHS Secretary and Chairman and CEO of the Sullivan Alliance to Transform the Health Professions, which is a national organization dedicated to diversifying the nation's healthcare workforce. And Dr. Sullivan sent us the following remarks for today's event, quote, "The NeoMed Cleveland State University partnership, strengthened by this grant from the Cleveland Foundation, is a model for the country. This comprehensive approach, grounded in the community and committed to mentoring, training, and retaining of health professionals to serve Ohio citizens provides a model which will be emulated in other states and regions. This will also stimulate needed policy changes at the federal level, end quote. This is a huge endorsement on a national level, and it speaks soundly about the level of collaboration in our community and in this room today. Our vision for CSU and NeoMed is to access healthcare for underserved urban populations, to provide access to education for diverse students in a team setting, and economic development of Cleveland communities. We need to train practitioners across such disciplines as medicine, pharmacy, nursing, and allied health professions, and we need to work strategically with partners and supporters to provide the healthcare workforce of Northeast Ohio. That is our core mission. We have a unique opportunity as population health, accountable care, and healthcare reform all combine to make healthcare more accessible to the underserved. We also have a unique responsibility to develop students as healthcare professionals and make primary care physicians more available for the communities of the underserved. Lastly, I would like to express my gratitude and appreciation for the next speaker, as she is the person who is the guiding force in our efforts towards success and who is largely responsible for making the program happen and run so smoothly. Please welcome Dr. Sonia Harris Hayward.
Thank you, Dr. Gershon. I'm going to take a minute and just introduce our next presenter. He may be familiar to some of you, and some of you may not have met him. Carl Allaby, one of our students, who started the partnership in the fall of 2013. We are proud to announce today that he will be entering the medical school class this fall of 2019. We are very proud of Carl and equally proud of all of the students in his cohort will be transitioning in August. But right now, I'd like for Carl to come up and give you his perspective on the partnership.
So just like many young people, I had desires of becoming a professional of some sort. As a child, I dreamed of becoming a doctor. Unfortunately, the ambition to follow my desires was lost. Growing up in East Cleveland, the rapid economic decline negatively impacted my community. By the 6th grade, school fights were common, and being bullied was the norm, rather than the exception. Sometimes school fights and fitting in was more important than learning. Teachers tried to keep command of their classes, but buffoonery left them uninspired, with little time for quality instruction. Teachers adapted low expectations, which led to low achievement for me and many of my peers. When I graduated, I finished in the 50th percentile of my class with less than a 2.0 GPA. My dreams and aspirations of becoming a doctor were lost, replaced by the necessity to fit in and survive. Growing up poor, we went without lights, gas, and water on many occasions. When I turned 15, I obtained a job as a dishwasher. And I was finally able to take care of myself and contribute financially to the household. And I haven't been without a job since. I remember a teacher in high school referring me to drug counseling and informing my parents that she thought that I was on drugs, but she was surprised to hear that my eyes were bloodshot red and I was falling asleep because I had been working until 1 a.m. the previous night. At 17, I obtained a job at a local parts store, and by 19, I was able to open an auto repair business right in my community. I was a father by 18, and by the age of 24, I was raising 6 children. Because I had so many mouths to feed, it was important that my business be a success. To further the business, in 2006, I decided to pursue a business management degree from Ursuline College. In 2010, I received a bachelor's degree, graduated summa cum laude with a GPA of 3.98. It was at Ursuline where I rediscovered my childhood dream of becoming a physician. My second to last class was a biology class, which really inspired me to get back into medicine. This teacher, who taught the class would come in after working long shifts at Cleveland Clinic with bloodshot red eyes just like mine. But he would teach us enthusiastically, and he was really the catalyst behind me deciding to go back, to fulfill my childhood dream of becoming a doctor. So while taking courses at Tri-C, I learned about this NeoMed partnership, and I knew it was the perfect fit for me. I was really impressed by the program's commitment to urban primary care, and fulfilling the requirements of this curriculum has only broadened my knowledge and appreciation for the program and my community. And although the coursework is challenging, it is also exciting. My most exhilarating moment came while waiting for my test scores for MCAT. After finishing up with customers for the day, my nephew, who has also worked for me for 10 years, and I huddled around the computer screen as I accessed my account. When I saw the results, I was overwhelmingly happy and glad that I had overcome a major hurdle. As we celebrated, one of my technicians walked into the office, and he said, "Boy, it sounds like one of you guys hit the lotto." My reply was, "I just did." I will be the first in my family to ever go to medical school, and for my community, it means a lot. I know I am looked on as an example to follow. I know that there may be people who question whether or not they could reach their goals, even when the odds are stacked against them. I know the story of my life may offer hope to others who question their abilities. I am more than happy to be the one who encourages them to follow their greatest desires. Of course, I could never have achieved this without the help of those who are around me. My family, friends, and community have been extraordinarily supportive of my ambitions. In addition, all of the faculty and staff that I have encountered from my first undergraduate degree until this present day have also been encouraging and compassionate. I can't emphasize enough how helpful the staff here at CSU has been with helping me to achieve my dreams. The tutoring, clinical experiences, and MCAT prep kept me focused and engaged within the community and my studies, and poised me to make a difference in a place that I am proud to call home. In addition, all of the people who I've met within the numerous partnership activities have been embracing and helpful. I live less than 4 miles from where I grew up, but there's a stark difference in the economic and health opportunities between the two communities. The health outcomes for the people in my hometown and other nearby areas are vastly different from what I and other privileged individuals can expect. For too long, these disparities have gone unaddressed, and I am excited about having the opportunity to help make a difference. Although my children from my first marriage are grown, my current wife and I have 2 children, 5 and 3. And the challenge of raising a family while attending medical school will be difficult for certain, financially and emotionally. But my entire family is supportive. And I am thankful to know that there are so many people in this great community who are also supportive. I would like to thank all of you here today who are instrumental in helping me and many others like myself fulfill our dreams of becoming the physicians who will serve the community of Northeast Ohio. Thank you.